The United States has been in a healthcare crisis since the end of the 1960s, and this has been a continual problem extending decades well into the 21st century. More specifically, the provision and access of women's healthcare has been a highly debated topic, with controversial issues such as government-funded abortion dividing opinions. Women's healthcare refers to the diagnosis and treatment of anything that affects women physically and emotionally. Such examples include contraception advice, fertility treatment, sexually transmitted disease diagnosis and treatments, and the medical support through pregnancy and childbirth. This essay will highlight the fundamental flaws of the US healthcare system by looking into the advances in the provision and access of women's healthcare in the United States throughout the first part of the 21st century, and further exploring how these improvements may be in jeopardy under the current presidency of Donald Trump. One critique of the US healthcare system is that it is incredibly expensive. Data from the World Bank Group provides the health expenditure of each country as a percentage of their gross domestic product. Between 2010 and 2013, the United States saw a slight decrease in their healthcare spending. However, since 2013, that expenditure has been on a steady incline. As of 2016, their percentage of GDP expenditure is the equivalent to almost double what the UK and Australia spent that year. Not only is their healthcare system costly to the government, but is also hugely costly to the average citizen. A Business Insider article compares the cost of healthcare between countries and states that the average cost of healthcare to citizens is around $4,500 to $8,300 in 2017. This is the price Americans pay for their insurance through premiums and the deductibles, which is the amount the patient has to pay themselves before the insurance kicks in. A medical bill from 2011 shows just how expensive the cost of childbirth in the US can be. When one of the main critiques of the US healthcare system is that it is expensive, it makes government-funded healthcare aimed at supporting low-income people, such as Title X, even more critical in ensuring sufficient healthcare provisions. Michael Moore's 2007 film Sicko addresses the catastrophic state of the US healthcare system and how the narrative of private insurance being the best for the American public has been fed to the Americans since the 1970s. This film highlights the flawed foundation of the American healthcare system that works by incentivizing their insurance companies to provide less healthcare in order to reap greater profit. This equates to the larger issue of Americans being denied treatment despite paying for insurance. One example the film provides is of a woman who at 22 was diagnosed with cervical cancer, but was denied treatment through her insurance as they claimed she was too young and should not have developed the condition. When the system is built with the motto in mind that they are not denying treatment, only denying payment, it is clear that the system is designed not to help the people, but instead designed for big businesses to make money. Sicko compares the US with the Canadian system, which provides universal healthcare. The socialist state-run healthcare has been promoted as being anti-American, taking away from the ideology of the American dream and attacking the people's freedom. However, the film demonstrates how it is this mentality that could be hindering the performance of the US healthcare system. After Moore talks to several Canadian citizens, the film shines light on the truth that the Canadian state-run system is highly beneficial, with one key advantage being the security of knowing that becoming ill will not mean they will end up bankrupt. A big concern with expensive healthcare is that it can discourage people from seeking help when they need it. When a standard doctor's visit can cost between $100 to $200, it can be hugely off-putting to seek medical help. This has proven to be the case for many women in the US, as research from the Commonwealth Fund has found that more than one-third of women in the US skip care because of cost, versus 5% in the UK. This in turn has been shown to have negatively impacted the standard of women's health in the US. The research further found that US women are more likely to die in pregnancy and childbirth than other wealthy nations. This is a shocking fact considering how much America spends on healthcare, and clearly exemplifies a state of national crisis. Another problem that women's healthcare in America faces is the impact of religion on access and knowledge of healthcare. 1 in 6 hospitals in the United States adhere to Catholic doctrine, meaning certain aspects of women's healthcare are limited. A recent example of this is the case of Tamisha Means, who was 18 weeks pregnant when her waters broke and she was rushed to hospital in 2010. Doctors withheld information about the life expectancy of the fetus and the potential risks to the mother's health of continuing her pregnancy. Instead, she was sent away. She returned to hospital the next day bleeding but was sent away again, only to return later when she delivered the baby, who died straight after delivery, and Tamasha was left with a potentially fatal infection. This was due to the hospital adhering to the ethical and religious directives for Catholic healthcare services, which does not allow abortion even when the mother's life is at risk. This demonstrates how these hospitals pose a major concern for women's health, as the information that is withheld may have a detrimental effect on the women's well-being. Furthermore, religion affects other parts of women's healthcare, such as what is included in their insurance plans from their employers. This is something that came to light in 2014 with the highly controversial case of Burwell versus Hobby Lobby. The for-profit organisation Hobby Lobby refused to cover their employees for contraception, as it goes against their religious beliefs. The court decided on a 5-4 vote that Hobby Lobby need not provide health insurance coverage for methods of contraception that violate the religious beliefs of the company's owners. The results of the case are more alarming when looking at the votes of the female judges. All 3 of them dissented, which raises questions about who should be deciding the fate of women's health. It would appear unfair that something that can be so detrimental to so many women's health is allowed to continue on the ruling of men. In Ginsburg's dissent, she referenced the earlier 1992 case, Planned Parenthood versus Casey, which states, "The ability of women to participate equally in the economic and social life of the nation has been facilitated by their ability to control their reproductive lives." Thereby, the court's ruling that Hobby Lobby need not provide health insurance coverage for women's contraception can be viewed as denying women's equal rights to work and have control over their health.
President George W. Bush was in power for the first 8 years of the 21st century. Throughout his time in office, he made many reforms to the healthcare system, specifically for low-income groups, but not for women. His most significant achievement was the Medicare Modernization Act of 2003, MMA, the largest overhaul of the public health program in its history. It introduced entitlement benefits for prescription drugs, targeted mainly at low-income senior citizens. As new and expensive drugs have come into use, patients have found prescriptions harder to afford. The Medicare Modernization Act was designed to address this problem. It provided subsidies to support senior citizens with their prescription medications and prohibited the federal government from negotiating discounts with drug companies. Bush said, after the passing of the bill, "Today is a historic and momentous day. Seniors have waited 38 years for this prescription drug benefit to be added to the Medicare program. Today they are just moments away from the drug coverage they desperately need and deserve." Low-income Medicare beneficiaries without prescription benefits have higher out-of-pocket medication expenses that can discourage adherence to treatment programs due to the ongoing costs. Lack of prescription drug benefits is a problem that plagues Medicare beneficiaries in this group. In 2003, 31% had no coverage. Not only does this void lead to increased out-of-pocket spending for medications, it also increases the likelihood of deliberate non-adherence to medication and less spending on basic necessities. The cost of medication is particularly burdensome for low-income seniors who spend a greater proportion of their income on these expenses. Despite improvements in this area, approximately 45 million Americans, or 17.8% of people under 65, are still without health insurance during the Bush era. Although it subsidized the cost of coverage for about 14 million low-income beneficiaries, some beneficiaries face significant gaps in coverage and, as a result, were still liable for thousands of dollars in annual expenses. Furthermore, with this focus on the over 65s, very little happened as a way to advance the healthcare of women, and their treatment was somewhat neglected during the Bush era. The second presidency of the 21st century saw the arrival of Barack Obama for another 2-term administration. Obama arguably did far more than Bush to advance the equal healthcare rights and services for women's health. With the introduction of the Affordable Care Act, ACA, in 2010, otherwise known as Obamacare, it gave women access to guaranteed preventive women's health services and free wellness visits with no co-payment or co-insurance if they did not meet their deductible. Before this policy, many women's health services were not covered or were only offered via co-pays or deductibles. Moreover, before the Affordable Care Act, only about 12% of healthcare plans offered maternity coverage, and many were dubbed with a woman tax. Identical health plans used to cost women more than $1 billion more than men each year. The Affordable Care Act made this gender discrimination illegal. A few of the services for women included in Obamacare are well women visits, gestational diabetes screening, domestic and interpersonal violence screening and counselling, FDA-approved contraceptive methods, breastfeeding support, supplies and counselling, mammograms. By bringing down the cost of insurance and including preventive measures, this prevents minor health issues from becoming major ones. This is significant because over half of women in the United States have avoided or delayed preventive care due to cost, and 32% have given up basic necessities to pay for healthcare expenses. The Affordable Health Care Act aims to assist with the issue by ensuring that preventive measures are not put off due to cost. Before Obamacare, women of colour and LGBT women were disproportionately uninsured and subject to high rates of health insurance. Additionally, in some cases, women have been denied insurance or granted it at an increased price because of pre-existing conditions. These conditions often included receiving treatment for sexual or domestic violence, having had a C-section, breast cancer, or been pregnant. Since the introduction of the Affordable Care Act, health premiums are now based solely on how old you are, where you live, and whether you're a smoker, all factors which affect men and women equally. However, with all the advantages of the Affordable Care Act come some disadvantages. A side effect of employers trying to skirt around Obamacare requirements means some women are losing hours at work or even their jobs. Currently, companies with over 50 employees are required to provide health insurance to their full-time workers or face receiving a fine. A full-time worker is someone who works 30 hours a week or more. Therefore, many companies are cutting down their full-time staff to part-time or less than 29 hours, or letting some staff go if they have under 50. Other employees find it cheaper to pay the penalty for not covering health insurance, so many employees could face losing their healthcare benefits altogether. Since Obamacare primarily targets low-income workers due to its supposed affordability, this will hit the most vulnerable groups the hardest. Another disadvantage of Obamacare is the inclusion of things that are not necessarily useful to you personally, and including free preventive care such as birth control, which actually costs the consumer more in the long run. Obamacare includes all FDA-approved brand-name contraceptives and procedures, but these cost more money, so this pushes up the price of insurance premiums, even if you do not wish to use birth control. Health insurance plans are required to include maternity care, even for men, even if you do not plan on having children or are over the age of 40. This increases the cost for everyone, and there is no choice of a cheaper plan. There is a distinct lack of understanding of the benefits women are entitled to have with the Affordable Care Act, like services, types of care, and benefits covered in their plan, compounded by a lack of knowledge in how to enrol in the plan. This lack of understanding is worse in certain socio-demographic groups, with the poor, less educated, and those already uninsured being hit the hardest. These groups also experience high rates of unintended pregnancy and adverse birth outcomes because of inequities in access to care. In this context, the Affordable Care Act is insufficient in improving women's health care. Overall, people's expectations of Obamacare far outweighed the policy's success and the predicted improvements that it would make to women's health care. It proved to have limitations in access, cost, and employment opportunities, and still left many women in the midst of a healthcare crisis.
The election of Donald Trump to President of the United States in 2016 has had a significant impact on the politics of the Republican Party as a whole. Under the guise of reversing the policies of the Democratic Party during the 8 years of Barack Obama's administration, Donald Trump and the Republican Party have proposed increasingly right-wing policies. This can be seen from the Republican Party platform of 2016, which was released during the Republican National Conference in Cleveland, Ohio. The platform directly focuses on women's health, first making it clear that the Republican Party's official stance is one of pro-life or anti-abortion, by stating, "We assert the sanctity of human life and affirm that the unborn child has a fundamental right to life which cannot be infringed," on page 13. The platform continues by specifically focusing on women's health organisation Planned Parenthood, declaring, "We oppose the use of public funds to perform or promote abortion or to fund organisations like Planned Parenthood, so long as they provide or refer for elective abortions or sell fetal body parts rather than provide healthcare. We will not fund or subsidise healthcare that includes abortion coverage." Several federal actions followed the inauguration of President Donald Trump, which focused solely on restricting women's access to abortions. Notably, in January 2017, in one of his earliest acts as president, Trump signed an executive order reinstating Ronald Reagan's Mexico City policy, also known as the Global Gag Rule. The Global Gag Rule restricts international non-governmental organisations that receive funding from the United States, not only from offering abortions, but also from using private funds to provide abortions, or referring women to other groups who do provide abortions. The reinstatement of this policy is an assertion of the party's platform promise not to fund healthcare that includes abortion coverage in the United States and abroad. However, this is taken one step further by refusing aid to organisations that use their own money to fund abortions or even provide information on other organisations that provide abortions, even if they do not themselves. This policy is one which has been adopted by every Republican president since its creation in 1985. However, in March of 2019, Donald Trump expanded the policy, adopting a stringent version of the rule under which NGOs that refuse to sign will be refused all health assistance, including for HIV, primary care, nutrition, tuberculosis and malaria programs. The implementation of the policy has been shown to have negative effects on women's healthcare internationally. As reported by the Guardian newspaper, studies have shown that it has increased the number of abortions where the policy has been strictly enforced by decreasing access to contraceptives and other family planning support, and by forcing women to seek backstreet abortions. The critics say it leads to more deaths of mothers and babies. Aid groups have said that the reduction of funding for primary health clinics has affected treatment for other widespread diseases like TB, malaria and HIV. Despite this information, Trump expanded the policy to increase the amount of cuts to funding, emphasising the detrimental effect of the Trump administration to women's healthcare, not just in the United States but internationally. The Trump administration similarly announced plans to restrict funding to American organisations which provide women's healthcare services, specifically abortions. In February of 2019, Trump announced that organisations which provide abortion referrals would not receive federal family planning funding. In doing so, millions of dollars could be stripped from the funding of Planned Parenthood, which receives approximately $60 million through federal family planning funding. Planned Parenthood is a non-profit organisation which provides several services regarding reproductive health, including abortions and birth control, and is often the focus of attacks by anti-abortion activists, regardless of the fact that abortions are only a fragment of the healthcare services that the organisation provides. Not only has the Trump administration made steps to cut funding to organisations which interact in any way with abortions, but it has taken other steps to reduce the availability of abortion services. In May of 2019, Trump followed through with his proposal made in January of 2018 to allow healthcare workers to refuse to provide services such as abortions, sterilisation and assisted suicide, stating religious grounds. The presidency of Donald Trump has made it a key focus to restrict access to abortions, and in doing so has had a detrimental effect on all women's healthcare services. Particularly worrying about Donald Trump's attitude towards abortions is the rhetoric that is used by the president himself. Recently, at a rally in Wisconsin, Trump stated that doctors and mothers execute babies after they have been born, and has previously stated that late-term abortion was allowing children to be ripped from their mother's womb right up until the moment of birth. The language that is used by Donald Trump and the blatant disregard for the truth highlights that the president's attack on women's healthcare is one which is not going to end during his presidency.